1. Fatigue. Feeling overly tired, weak, or fatigued are non-specific symptoms and may also be signs of low blood sugar, Dr. Adamulam says. But it's important to get any fatigue checked out that doesn't go away with adequate rest. 2. Headaches. Headaches are incredibly common, so it helps to know what kind of headache you're dealing with. Migraines, for instance. However, any new, chronic headache deserves to be discussed with your doctor. 3. Blurred vision. Excess amounts of glucose in your blood can end up affecting your retina, causing a condition called diabetic retinopathy. As a result, you might notice blurred vision and extra floaters. 4. Frequent urination. That extra glucose can also affect your kidneys, which are responsible for removing the excess water from your blood to produce urine. Having too much glucose in your blood can damage blood vessels in your kidneys, which makes this filtering process less efficient and causes you to pee more. 5. Increased thirst. According to Dr. Adamulam, feeling like you need to drink more than usual is a natural side effect of peeing more often. If your high blood sugar symptoms are left untreated, they may become more obvious and severe over the course of a few days or weeks. According to our experts and the Mayo Clinic, here's what could happen if your blood sugar is too high. 6. Difficulty concentrating. 7. Dry mouth. 8. Increased hunger. 9. Confusion. 10. Shortness of breath. 11. Abdominal pain. If you're so sick that you can't keep food or fluids down, you need immediate medical attention. Otherwise, make an appointment with your doctor. You can use your food choices to lower the odds you'll experience these symptoms. If you do have diabetes, it's important to stick to your individualized nutrition plan. And, if your symptoms are caught early enough, it is possible to lower high blood sugar with lifestyle changes alone, including both diet and physical activity. Although there's no set diabetes diet, most people are advised to make fruits, vegetables, and whole grains the bulk of their diet because they're low in sugar and high in fiber. Sugary foods are usually still okay every once in a while, but how much and how often you should have them will depend on your individual circumstances, including whether you have type 1 or 2 diabetes. A large part of this process is educating patients about which foods are truly healthy, Dr. Adamulam says. Even quinoa, something we generally think of as being healthy, still has carbs that can interfere with your blood sugar. For help putting together a nutrition plan, check in with your doctor, who may refer you to an RD. If you're regularly experiencing the symptoms of high blood sugar and aren't sure why, talk to your doctor. If your doctor suspects you might have diabetes, they'll do a blood test to see the amount of sugar in your blood that's physically attached to hemoglobin cells, Dr. Adamulam says. The higher your blood sugar over the past few months, the more of those hemoglobin cells will be attached to sugar molecules. However, that test's results may be inconclusive or the test may not be available. In that case, you'll be given a different type of blood test, possibly one that requires you to fast. And, if your doctor thinks you might have type 1 diabetes, there may be a few additional tests to look for compounds in your urine and to test your immune system. Treatment for diabetes, in addition to managing your nutrition and exercise, may include monitoring your blood sugar, medication, and insulin therapy. People with type 1 diabetes definitely require insulin in the form of a pump or injections, as do many but not all people with type 2 diabetes. In some cases, people with type 1 diabetes may opt for a pancreas transplant, which would replace the need for insulin therapy. Diabetes is obviously a serious condition, so it's crucial to be aware of the sometimes subtle signs, and to see your doctor if you have any concerns. Subscribe and leave a comment on what kind of videos you would like to see tomorrow. I will randomly choose